I'm an X-linked Alport patient. I'm a retired dialysis nurse. I'm on the Alport Board of Directors and work closely with our Facebook support group as well. I am delighted, as many of you know, to be able to moderate the session on renal diet and nutrition, certainly one of my passions out there for our community. And I'm delighted to introduce to you Carolyn Feibig, a renal dietitian who will proceed with introducing herself.
Hi, everyone. My name is Carolyn, and I am a renal dietitian. I actually work in transplant, but before that, I worked in dialysis. And I was just talking to the little core group of people behind the scenes just now about how I fell in love with the kidney community and the importance of renal nutrition. And it all stemmed from when my nephew was born with one working kidney. So, I mean, and it was right at the same time when I was like back in school to become a dietitian. I was like, this is my goal in life, right? So with no further ado, I'm going to share my screen. You know, technology is amazing until it's not. So bear with me. Hold on one second. All right. So it looks like it's all working just fine. I'm going to go ahead and voila. So basically this is Renal Nutrition 101, right? It's going to be a quick, because we've got 45 minutes, and I want to give everybody a nice, good amount of time to ask me questions because diet is so person specific. But this is, I hope for it to be an in-depth view, kind of covering renal nutrition at every single stage. So without further ado, right? Renal nutrition can be really confusing. It's the opposite of what we think is healthy. It is different between each different stage. There's little different nuances. There's conflicting information on the internet. You know, sometimes people are like, do this or don't do that, or they're not as specific as it needs to be. And also, until you get to dialysis, very few people actually are able to find or work with a renal nutrition dietitian. And that is, I think it's paramount to help have somebody with you, guiding you along the way, trying to help you navigate through these confusing terms and questions and differences between each different stage. Sometimes nephrologists don't even know, they don't have a dietitian that they work with besides possibly the one that they work with in dialysis. So stage 1 and 2, what does that mean? That means like your GFR, which I'm sure you've heard a lot about, but that's basically monitoring your kidney function. When it's 60 or higher, that means you're in like mild kidney dysfunction. And this is a perfect opportunity to make some lifestyle changes if you haven't already, right? So a lot of times kidney disease is because people have uncontrolled diabetes or uncontrolled high blood pressure. That's not the case here, right? But just because that's not the case doesn't mean that there's not some opportunities to maximize your diet and your lifestyle. So making sure that you're eating a well-balanced diet, increasing that daily physical activity. I know it's summertime and I know it's in the times of COVID and we all need to be wearing a mask and it's hot as all get out. I mean, it's been over 100 degrees heat-wise here in DC for the past like 2 weeks. So I'm trying not to go outside. But it's really important to try and get at least 30 minutes of some type of daily activity, at least 5 days a week, maintaining a healthy weight. Normally that means having a BMI in between 18.5 and 25, but really honestly, just making sure that you have a BMI under 30, and that's good. Limiting your salt intake. Decreasing your highly processed foods like fast foods or salty and sugary snacks and beverages. That's going to help decrease that salt intake as well. If you do have diabetes, controlling your blood sugar. Diabetes is the #1 cause for renal disease. So you don't want to exacerbate what's going on right now with you by having uncontrolled blood sugar. Same thing with high blood pressure. Your kidneys can either cause high blood pressure, or high blood pressure can cause kidney failure. So making sure that if you do have high blood pressure because of your kidney dysfunction, making sure it's well controlled. Just because you're taking medication doesn't mean that your blood pressure is well controlled. Check your blood pressure, monitor that. And then also go to regular doctor's visits, right? That's one of the most important things. How do you know if what you're doing is right and helping if you're not going to the doctor? So what does a well-balanced diet mean? It means a variety of vegetables. So stage 1 and 2, really honestly, there's really no change from what is considered a nice and normal healthy diet. Choosing a variety of vegetables, being more vegetable forward, choosing fruits as your snacks versus like chips and candies and things like that. Choosing whole grains instead of refined grains. Whole grains have all of the fiber and all the nutrients that are surrounding that little grain pod versus the refined grain, which has that all removed to make it easier to process and things like that. So choosing like a whole barley instead of rice. So choose barley instead of rice if you're going to have a rice dish. Choose quinoa instead of couscous. Couscous is just white pasta that's very small or in little pearls. Choosing quinoa, which is a whole grain, has a ton of fiber, has a ton of protein. It's actually a whole protein source. Then protein, right? So choosing lean types of protein. You don't need to restrict your protein right now. Protein is an important building block of our muscles, of life, really. It helps deliver things. I'll get to that later on, but really choosing like the lean sources of protein: fish, poultry, beans, low-fat dairy, soy, whole grains that are good sources of protein like quinoa and things like that, and limiting your intake of red meat. So red meat's not just beef, right? It's pork, even though they like to call it the other white meat, and lamb and goat and things like that. And when you do choose to have some red meat, make it a lean source of red meat. Like eye of round, top sirloin, filet, those are all lean sources of red meat. If you go to the grocery store and you look in the butcher's case, if there's a lot of white lines going through the meat, that's called marbling. That's a lot of fat. That's saturated fat. That's going to increase the cholesterol and all sorts of things. So choosing a leaner cut where it doesn't have as much of that inside fat. You can always cut off the fat from around the outside, so that's okay. But choosing the one that doesn't have a lot of marbling. Choose water. Water, right? 64 ounces of water every single day, not like juice or tea or coffee or soda, and especially, like limiting those things that have added sugar or added calories to it, like the sugary sodas and the juices and the sweet teas and whatnot. 64 ounces is 8-ounce glasses a day. That might seem daunting, but maybe you choose to have 32-ounce cups of water a day. Finding a fun glass or something like that helps to make water drinking a little bit more enjoyable. And limiting added salt. That means when you cook, don't add salt while you cook. Don't add salt to your pasta water. Don't choose things that are going to be processed from like the grocery store or fast foods, or when you go to a restaurant, say, hey, please don't add any salt to whatever you're cooking for me. Making your own seasoning, your house blend, like a lot of restaurants are making their own like house blended ketchups or this, that, and the other. Do that for yourself. It makes it fun. There's a lot of recipes out there, but I mean, you can, in my opinion, you can never go wrong with, either Mrs. Dash or like garlic powder and oregano and basil. I mean, I do like a good Italian seasoning, right? Then you've got stage 3. So like you've got stage 1 and 2, that is mild dysfunction. Now you've got stage 3, which is actually now a little bit on the moderate side, but you just still don't need to do too many drastic changes right now to your diet. But again, just know that your kidney dysfunction is progressing. They've actually broken it into 3 different stages, stage 3A and stage 3B. 3A is obviously it's, 45, your GFR is a 45 to 59. So it's closer to that 2, where it's 3B is closer to 4. You want to continue those lifestyle changes that we talked about, making sure that you are exercising. And I'm not talking about like you have to go to the gym, you have to run marathons. I'm just talking about just daily, everyday physical activity, doing something, right? Just even if it's marching in place while you're watching TV because it's too hot outside to go outside on a walk or whatnot. Making sure that you're maintaining that healthy weight and you're limiting salt and things like that. You might even start noticing some infrequent symptoms that might be related to your kidney disease. It could be you've noticed some feet and hand and maybe your fingers and ankles are swelling maybe towards the end of the day. Maybe you notice it if you eat something super salty and that's your body holding on to that water. You might notice your some soreness or lower back pain, and that's actually because your kidneys are located in your back. And you might also be like, oh, I'm kind of tired. I'm feeling a little bit sluggish, a little bit run down. Again, your kidneys do so much, right? They regulate your blood pressure, they filter your blood, and they also produce a hormone called erythropoietin, and that helps produce red blood cells, which gives you energy. So the differences in your diet, right? We still want you to continue that well-balanced diet. We want you to eat a variety of vegetables, a rainbow of vegetables, right? Eat the rainbow, not the Skittles, but eat the rainbow. And then choosing, again, fruits as your snacks, whole grains versus refined grains. Again, choosing your lean protein. But remember, back stage 1 and 2, it's just like limiting your red meat. Now, it's important to limit your red meat to probably even less than once a week, maybe like 3 times a month or something like that. And again, choosing those leaner cuts of red meat. Again, choosing water, avoiding the fruit juices and the sodas and the things like that. Limiting your phosphorus additives. I'm going to get into this and I'm going to show you an example of what a phosphorus additive is in a further down the line slide. And then again, limiting your added salt. So maybe in stage 1 and 2, you didn't have to be as particular, but now that your kidney function is declining, progressing down the way, choosing fresh or frozen vegetables. I think frozen vegetables and frozen fruit get a bad rap. They are great. They are actually, a lot of times, have more nutrients in them than, let's say, a fresh vegetable. Let's say they pick the green beans in California and you live in DC where I live. Well, that's going all the way across the country. Those nutrients are being lost every step of the way. But let's say they pick the green beans in California and then the frozen green bean plant is on that, 10 minutes away. Well, they go there and now they're being processed and frozen right away. As long as they're not in any type of sauce or syrup or anything like that, then they're a great choice. They're cheaper, they're fresh year round because they're frozen at the height of their freshness. Avoiding canned vegetables for the most part. If, let's say, you're going to eat canned beans, rinse your canned beans. Choose low salt tomato products because very few people are out there making their own tomato sauce and things like that. You don't need to probably at this time be worrying about your potassium. Potassium is a small little molecule that your kidneys are able to filter really well. So low potassium at stage 3 is probably, everybody's kidney journey is their own. So maybe their potassium is a little bit higher in stage 3, but overall, generally, it's not. But choosing low salt canned tomato products, anything, like if it says low salt or whatnot. Again, I cannot stress this enough, avoiding fast foods, avoiding those processed foods like the chips and the snacks and the whatnots. And then when you go to restaurants, really be vigilant. Restaurants are now, nowadays, restaurants are a whole new ball game, but restaurants are used to people with diet restrictions. So ask them, say, hey, I'm really trying to limit my salt intake. Can you please just not add any salt to the cooking? Let's say you really like takeout Chinese food, very, very salty, highly, that's not an everyday food. But there's a lot of times the diet menu, and that doesn't have any added salt and things like that. So that is a great opportunity or a great way to limit your salt in Chinese food. And again, make your own house blend, your house seasoning blend. It's fun, I love to cook, so there's that. Stage 4, now you're actually in severe kidney dysfunction. You're not on dialysis, but you're creeping up there. So continue those lifestyle changes. But now you might notice more symptoms, swelling in your feet and ankles and hands. Again, limiting salt is going to help with that swelling. You might always kind of feel this constant back pain. You might be always feeling a little bit tired and run down. You might notice a buildup of metallic taste in your mouth. That's the buildup of these waste products that your kidney is not able to get rid of. Maybe chewing some gum, things like that, because it might make you not want to eat, and then you might actually start getting a little bit on the malnourished side. Your urination might go up, it might go down. It just depends on what your kidney disease looks like. But always continuing on that well-balanced diet. But now you're going to really need to change it up towards your labs, because you should be going to your nephrologist on a consistent basis, probably once every 3 to every month. And they will be checking your labs. You should always ask them, hey, what's my potassium? What's my phosphorus? You have the right to know these things. So always be inquisitive. So now that you're stage 4 kidney disease, you're going to have a more restricted diet. Home cooked meals. I know it's hard, but home cooked meals are way easier for you to have a handle and to have control of what's going on, versus the highly processed foods, the fast foods, the restaurant things. That doesn't mean that you can't do those things every once in a while, but it's certainly on a less frequent basis. Low salt. Now it's really maybe you should not be adding salt to anything. Maybe you need to be even more restricted when you go out to eat, and you make sure that you're really selecting those foods that don't have added salt. It needs to be vegetable forward now, more so than it did in the past, right? So fruits and snacks, whole grains, all of these things are good for you and for your kidney health. Now, whole grains, you might need to limit a little bit because of the potassium. And again, that's going to be something that you're going to be looking at every time you go into your doctor. But now some of the difference, avoid red meat. Remember, beginning, it's kind of limiting red meat. Then stage 3 was a little bit less than once a week. Now it's avoided, just in general. Red meat actually is a vasoconstrictor. It constricts those vessels, so it raises your blood pressure. It also, in your kidney, there's a little, the nephron is the workhorse, and then there's the glomerulus, and it sits in there, and this vessel right here can get constricted, and it makes a hard pounding when the blood goes in onto your nephron and your glomerulus, and that can damage the kidney and speed it up. So you want to avoid things that are going to raise that blood pressure and constrict those vessels. So avoiding red meats, limiting your protein intake, in fact. So having more some vegetarian days, that's a great thing. You don't have to become a complete vegetarian or a complete vegan if you don't want to, because you got to do what works for you. You might need to start limiting your fluid. So fluid's not just water, and your fluid should at this stage only be water. Soups, gelatin, ice cream, really anything that is liquid at room temperature, ice. Those are all considered fluids. You might need to start doing that. You're going to have to look at your ankles and feel how you feel when you lay down. Are you short of breath and things like that? Avoid phosphorus additives. Again, we're going to get to that. And then you might also need to choose lower potassium foods at this stage. Stage 5, there is stage 5 non-dialysis. You're going to be a little bit more strict than if you were on at stage 4. Really, really, really watching those labs. But that means that dialysis is pretty much imminent. Stage 5D, or it's basically when you're on dialysis, you're going to have a dietitian work with you, and they're going to help you navigate through all these things. But you might also start noticing that you can't continue some of these new lifestyle changes that you had made. So you might need to modify them. Maybe you can't do 30 minutes of exercise every single day, but maybe you can do 5, maybe you can do 10. The better in shape you are before you start dialysis, the better in shape you are while you're on dialysis and afterwards. And I'm not talking about bodybuilder shape. I'm just talking about physical activity, walking from point A to point B. You might notice that you're itchy. That could be because you have some high phosphorus. You might notice you have trouble breathing. That could be because you have too much fluid. You might have a stronger metallic taste. That means you're having more and more and more buildup of those waste products in your blood and your kidney isn't filtering it. You might notice a decrease in appetite. You might have muscle cramps. That could be because you have too much potassium. And you might also feel nauseous and you might start vomiting a lot. And that might not ever go away on dialysis either. But again, like I said, once you're on dialysis, you're going to have a dietitian. They're going to work with you. Honestly, let's say you never see your dietitian. They're only there one day a week or something like that at your dialysis unit. Make an appointment. I bet you she or he will be all about it. We very rarely do people ever want to talk to us when they're on dialysis. So make an appointment and we will jump at the chance and we will work with you. Absolutely. But really it's low potassium, it's low phosphorus, it's low in salt, low in everything, right? Besides protein. Then we want you to eat more protein. And let's say you're a red meat eater. Well, if you like red meat, this is an okay time for you to eat some red meat. But now you're going to need to restrict that fluid too. So low potassium, low phosphorus, low salt, low fluid, high protein. So now we've gone through all the stages and now you've got a transplant. Yay, congratulations. And there's a lot fewer restrictions with your diet when you're on when you've gotten a transplant. There are some possible nutrition side effects though, because of these medications. It can make your potassium high or low. It can make your magnesium low. It can make your phosphorus low. It can cause you to have high blood sugar or even possibly medication-induced diabetes. Some of these medications can cause diarrhea, which is no good either. But the main thing is food safety. We want to make sure all that food is cooked and things like that. These medication levels are going to be tracked by your transplant team. A dietitian is required by law to be part of the team. So use him, again, I love it when people call me. I love it when they are listening to me and they're like, hey, can I do this? Can I eat this? That's what we're here for. And that's like our jam. We love to talk about food and we love people asking us questions about how to maximize their health. Common restrictions when you have a transplant, no grapefruit. It interacts with that special medication called tacrolimus. Nothing undercooked, no undercooked or raw meat or including eggs and seafood like sushi. No unpasteurized dairy, no cold buffets like a salad bar. These are all potential foodborne illness havens, right? Now, there's no buffets right now during the times of COVID, but hey, there you go. What we do want, increased fruits and vegetables. Let's say you do have some higher potassium. That's okay. You're going to work with your dietitian and your transplant team. They might be able to do that just by making a few tweaks. You might need to be on a potassium binder, something like that. You will need to increase your water again, back from that, instead of the 32 ounces, up to 64 ounces every day of water. Water, 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 so important. And then choosing lean sources of protein. If you want to be a vegetarian, totally fine. If you don't, totally fine. Should you be eating red meat every day? Absolutely not. No one should. And I'm certainly a carnivore, so don't think that I'm like trying to push any agenda at all. And then also, you want to start choosing foods that are going to help manage your labs. Every time you go into your transplant office, they should be checking your labs. They should be letting you know what they are. If they're not, you can call them, you can ask them. They always want to help. And if your potassium is high, eat low potassium foods. If your potassium is low, eat high potassium foods. And you can work with your dietitian and make those things happen. The whole thing about kidney disease is everybody's kidney function and kidney labs are different. And it's all about what is going on with you, not about what's going on with your neighbor or Sally Sue down the road. And then when it's a genetic disease or a genetic thing, it involves kids, so pediatrics, right? So honestly, a lot of kids with kidney disease, they have delayed growth because it involves, your kidneys do so much. They help with bone health. They help with red blood cell production. And also, like when you're not feeling good, when your kidneys aren't working and they're not filtering out your blood, you don't really have much of an appetite. So honestly, there is a lot fewer of these restrictions because of the need for growth. So we're not going to be restricting calories or even protein when you are a kid with kidney disease. We want you to get at least 80% of your estimated calorie needs. You might even need to get your kid a protein supplement or just in general supplement. I know this sounds crazy, but like Slim Fast is a great supplement if you use it in conjunction with a meal, right? So like instead of a meal replacement, use it as a snack type of deal. And again, focusing on lean proteins. You might even need all the way up to 140 of the recommended amount of protein when you're a kid with kidney disease. And it is all depending, again, on that specific child, right? So where are they on the growth chart? What is their nephrologist or their pediatrician talking to them about? Where are they on that growth chart? You know, are they on the lower side so they need more? Or are they normal and they're just fine? That's, you know, how you have to look at it like that versus like, I should do this and stay in the strict lane. It doesn't have to be plant-based. If you want it to be plant-based and your kid likes plant-based, that's great. But making sure you're choosing, again, more of the whole non-processed foods versus these processed foods. Limiting hot dogs and hamburgers and fried chicken sandwiches and the filet of fish sandwiches, you know, salamis, pepperoni, any of these like really highly processed things. We want you to limit those. I am really running short on time, so I'm going to hurry up so we can get all the questions in. But limiting sugary cereals and salty foods and snacks, but making it fun. Make it fun. When it comes to kids, it should be fun. Fun. Get them in the kitchen. Have a garden if you have the opportunity to do that. When kids grow things, I used to be a 5th grade teacher and a preschool teacher, so I really know this for true. If they grow it, if they make it, if they cook it, then they're going to want to do it. Take them to the grocery store with you. It might be a huge pain. Oh my goodness, I can't even imagine. But let them pick out a few things. Look through some recipes. Let them pick out what they think sounds good. And that might, especially if they have a bad appetite, that might help get them to eat a little bit more, be a little bit more excited about it. Modeling the different behaviors, making sure you're drinking 64 ounces, making sure you're not eating like chips and salsas and things like that. Just make it fun. If it's fun, the kids are going to remember it and they're going to want to do it.
Carolyn, let's shift to some of the questions.
Yes. Okay. Sorry.
Okay. No, it's quite fine. I just don't want to miss out on that opportunity too. So I'm just going to take them right off the Q&A that's been coming in. Are drinks like LaCroix, coffee, and tea okay to drink?
Okay, I think LaCroix absolutely is. It's sparkling water. I mean, should you only be drinking sparkling water? No. But coffee is fine. It is dehydrating. Tea, anything with caffeine is going to be dehydrating. But a cup of coffee here, a glass of tea there, no, that's totally fine. If you're a coffee drinker like me and you drink 20 to 40 ounces of coffee in a day, you got to resupplement that with more water. Don't add a whole bunch of like sweeteners and sugars and things like that to like your tea and to your coffee. But having those things, they're an okay thing.
And is it important to follow a renal diet to preserve kidney function before the loss of your kidney function, before you start losing much of your kidney function in Alport syndrome?
I don't think so. Because that kidney diet is, I always like call it the, I call it like the Wonder Bread diet, right? So it's devoid of all, all nutrients. It's stripped away, and then you take like a renal vitamin. So what you really should be doing in stages 1, 2, 3 is maximizing your nutrition through fresh fruits and vegetables and water and lean proteins. You know, some vegetarian days I think are a really great start. I think we all should have some vegetarian days, and making sure that we're not getting too far into those like faux meat products because they're just as processed as other things.
And so there are a couple of questions regarding plant-based diet, and so tying them together, one is about looking at protein sources that are vegetarian, but are also high in potassium and phosphorus. And the other would be looking at sources of protein that are not robust protein sources, but still grams of protein per serving.
So no matter if it is a animal protein source or a plant protein source, it is going to be high in phosphorus and potassium. Also, if you think about like looking at the ingredient label, right? So if you're on the ingredient label and it is, and there's a lot of phosphorus additives, right? So it's calcium. Like here, I have actually show it real quick. Sorry. But like if you, I'm just trying to share my screen again because there were some, like here, if you can see where it says like ingredients and it's like tricalcium phosphate. So any of these things that you're going to find in any of those processed foods, maybe it's a meat alternative, maybe it is a package of Ritz crackers, maybe it is some lunch meat. Those are going to be things that you're going to want to stay away from.
Are alkaline water options okay?
So alkaline water, they are made alkalinic by adding potassium. So I do not believe that they are okay for the kidney community. Also, if you're trying to decrease your acid by drinking something that's alkaline, you're kind of going against what is happening, because what happens is your body, your stomach makes, like anytime you put any food into your body, it's going to shoot out like that hydrochloric acid that's in your stomach. That's going to raise that acidity level in your stomach too. It gets down to like a pH of 2 to 4, right? And then when it gets into your duodenum, that's when it's going to shoot a whole bunch of like basic or alkalinic, which is sodium bicarb, at it, and then it's going to lower that, or it's going to raise that that pH level to a more alkalinic. But if you're drinking alkaline water, you're going to have to produce more acid in your stomach to get it lower. So.
And what about pink Himalayan sea salt? This person understands the renal effects are not the same as with table salt.
Salt is salt. You may use less pink Himalayan sea salt because it's a finishing salt and it's more expensive than that really fine ground table salt or iodized salt. But it's NaCl, the compilation, and a teaspoon of salt is about 2,300 milligrams of sodium. Maybe pink Himalayan sea salt would be less because the flakes are bigger. But so I mean, that's a finishing salt. Use it sparingly. Use all salt sparingly.
This is a comment. Protein supplements and increasing protein intake in Alport patients is greatly frowned upon by the pediatric nephrologists. Would you care to respond?
I went by the Kudoki guidelines that are set out by the National Kidney Foundation, and they are all research and science-based. I think a lot of people are getting excited about plant-based diets and low in protein. If you are 16, you probably don't need as much protein as you do if you are 10 or if you're 5. So it's all based on age and age by weight. If you're growing at the right rate and things like that, then absolutely, then you probably don't need protein supplements. But if your child has a low body weight and they're not eating, then they might need a supplement.
Is there a good resource for a diet menu for people who do want to eat plant-based?
There is a book called Plant-Fed Kidney. It is written by a dietitian who is also a dialysis or now transplant patient. She's a dietitian, so I believe that is a good resource. There's also, hopefully these slides will be made available to everyone because there are some resources. There is the American Kidney Fund has a website called the Kidney Kitchen, and you can go on there and you can just do like you can click vegetarian, and they have hundreds of recipes that you can pick and choose to be vegetarian but still get enough protein. Also, there was a question about protein and vegetarian protein in amount, right? So like 3 ounces of chicken breast, let's just say, is about the palm of my hand. That's about 21 grams of protein, about the same amount of phosphorus and about the same amount of potassium as a half a cup of beans. But a half a cup of beans only has 7 grams of protein. So it's hard to get in as much protein as required, especially if you're on dialysis. Now, if you're trying to restrict your protein, then beans are a great option. Great option for that, because then you're not going to get as much protein for the same volume.
Does caffeine-free tea count as part of the daily water intake?
Yes and no, right? I mean, I think you have a little bit more leeway with that. There has been no science-based research saying that it does or doesn't. Caffeine-free tea is definitely better than caffeine tea if you're going to drink, if you're a tea drinker. But still, 64 ounces of tea is not the greatest. It's still a little bit harder on your kidneys than water, but you could drink a little bit more, right?
So one of the questions is asking about access to a renal dietitian. As a renal administrator, our programs made our dietitians available both to our CKD patients that came through CKD clinic. They could come in as early as stage 3, and as well as the responsibilities of their rounding in the dialysis units. How does your program work, and what are you hearing in the dietitian colleague group about that access?
I think the access is overall pretty poor. I think that it is a special place that has a dietitian that's available for people in CKD stages 3 and above. There are some dietitians who are doing that on their own, and you can like Google renal dietitian and put in like in the like nutrition websites. They're myplate.com or something like eatright.org, which is the dietitian professional. You can say find a renal dietitian in there, and they will find one in your area. There are some that do it virtually. Some take insurance, some don't. Insurance, I know, does cover dietitians to be seeing CKD stages 3 and greater. So, but it's a real pain for a dietitian to go and navigate that whole system and to get that all set up. I'm actually in the process of trying to do that myself, because I think it is a very missed market. And I think a lot of people can slow down their kidney disease and not end up on dialysis or really prolong that before.
Right. Do you have any specific diet recommendations for women with Alport syndrome during their pregnancy?
Pregnancy is so hard. It all depends on where you are in your kidney disease, right? Or it's kidney progression. Working with your nephrologist, making sure that those B vitamins, making sure you get enough folate, making sure that you're getting enough B12, making sure that you're getting enough protein to support your baby, but not damage those kidneys. I would have to like look at some labs and see, specifically what I would recommend, but good hydration, B vitamins, well-nourished, physical activity.
So once again, it goes back to being very individualized to a specific patient.
Yeah.
Mm-hmm.
It's all, and that's the thing. Diabetes, it's like, eat this amount of carbs for this day, eat this amount of carb for this meal, eat this amount of the carbs for this meal, high blood pressure, exercise, and eat low salt. Kidney disease, it's like, well, what is that potassium today? But maybe next time you get it checked, it's a different number. And now you're going to have to change your diet again. And so you just got to know those labs. You got to know your values. You got to be your own best advocate or your child's own best advocate and talk and talk and talk. That same website, the Kidney Kitchen by the American Kidney Fund, has a lot of downloadable list of like potassium and phosphorus and protein and like what to do when type of deal.
So the opposite end of a small child is this woman's son, who is a big child. He plays football. How do I balance his fluid intake and protein intake to maintain optimal kidney health and diet for Alport syndrome?
Yes. So again, gosh, he's going to need more protein just because he's bigger, right? And he's active. He's going to need more fluid, and not like Gatorade, but water. And maybe even sometimes, let's say, I don't know what's going on with like football practice nowadays in the times of COVID, but let's say they're doing 2-a-days and it's hot outside and you live in the South, right? And you're sweating and you're sweating and you're sweating. Well, he's going to sweat out some of those electrolytes. And so maybe a Gatorade would be an okay thing. And he's going to be getting rid of some of that fluid. So maybe having a little bit more fluid. If he's in stage 3 or over, then probably fluid's not an issue and he can just drink as much as he needs to. Again, always water is best, but maybe, supplementing in a rehydrating style drink on like a hot football practice heavy day. And then making sure that it's not too much of the red meat and incorporating in some of the beans and the tofus and the chickens and the fish versus like the burgers and the easy, things that me as a teenager wanted to eat.
Can you describe what role cholesterol plays in the kidney diet? And also, how about alcohol, adult beverages for folks with Alport syndrome?
It's funny, my transplant surgeon always talks about how, like, when there's a deceased donor, there is we're almost done. This is our last question. Okay, so alcohol shouldn't be a big deal. You shouldn't over imbibe. You shouldn't overdo anything, especially when it comes to fluid status and alcohol. You want to have, if you post-transplant, you want to have a drink or two once or so in a month. That's okay. If you're on dialysis, you want to limit that fluid, and I would not choose to drink alcohol on dialysis. I think that's probably not going to, every once in a while, special occasion, that's okay. And what was the other part of the question?
Cholesterol and kidney disease.
Cholesterol and kidney disease. You're restricting so much that I don't think that you should really be worrying about your cholesterol, especially if you're following that well-balanced diet, right? If you're eating a well-balanced diet, you're not going to be eating a whole bunch of cholesterol, right? Also, it really shows that like cholesterol, like in eating foods that are high in like cholesterol doesn't raise your physical cholesterol. Eating foods high in saturated fat, like red meat, does. So another reason why you want to limit the red meat.
Carolyn, this has just been extraordinary. I know that the questions could go on for a very long time, and hopefully will over in the virtual cafe.